Welcome to Review Central. This is Midwifery Licensure Exam Reviewer number 9, featuring questions on primary or fundamental health care. Please note that this reviewer is specifically prepared for the Midwifery Licensure Examination, given by the Board of Midwifery, and administered by the Professional Regulation Commission of the Philippines. The questions on primary or fundamental health care are specifically focused on the healthcare situations, issues, programs, policies, practices, laws, and interventions in the Philippines, and may not be applicable to other territories. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous midwifery licensure exams. Before we proceed, don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Now let's begin. Question number 1. Which is number 2 step in the sugar test with the use of Benedict solution? A. Heat again until it boils and observe for any change in color. B. Heat over the flame. C. Add 3 to 5 drops of urine, shaking it simultaneously. D. Place 5 cubic centimeters of Benedict solution in the test tube. The correct answer is C. Step 2 in the Benedict's test is to add 3 to 5 drops of urine, shaking it simultaneously. Benedict solution, also known as Benedict's reagent, is a chemical reagent and complex mixture of sodium carbonate, sodium citrate, and copper sulfate pentahydrate. It is often used in place of Fehling solution to detect the presence of reducing sugars. Benedict solution is blue if simple carbohydrates are present. It will change color, green or yellow if the amount is low, and red if it is high. In the Benedict's test, a mixture that contains the reducing sugar and Benedict solution is heated in a test tube for around 2 minutes, and is then allowed to cool. The color of the mixture changes accordingly and results in precipitates. Here's the step-by-step procedure. 1. Approximately 3 to 5 milliliter or cubic centimeters of Benedict's reagent is placed into a clean test tube. 2. About 3 to 5 drops of sample, that is, urine, is added into the test tube. 3. The solution is then heated in a boiling water bath for 3 to 5 minutes. 4. Observe for color change in the solution of test tubes or precipitate formation. Note that steps 1 and 2 may be interchanged depending on the testing laboratory or facility administering the test. Also, the amount of sample and solution may vary as well, but it generally falls within the 2 to 5 milliliter range. If in doubt, refer to your laboratory or facility's operating manual. Question number 2. Which of the following exercises teaches expecting mothers to inhale, exhale, and relax during delivery? A. Shoulder circling. B. Pelvic rocking. C. Abdominal breathing. D. Tailor sitting. The correct answer is C. Abdominal breathing. Abdominal breathing teaches expecting mothers to inhale, exhale, and relax during delivery. Here are the 2 very simple abdominal breathing steps. 1. Breathe in gently and slowly with your mouth closed, allowing the abdominal wall to rise as far as possible. 2. Then breathe out through your mouth, dropping the abdominal wall. Question number 3. Nausea and vomiting are the most common complaints of pregnancy. If they become severe, the condition is diagnosed as A. Pica. B. Tilism. C. Heartburn. D. Hyperemesis gravidarum. The correct answer is D. Hyperemesis gravidarum. 70 to 80% of all pregnant women experience some form of morning sickness during their pregnancy. Hyperemesis gravidarum, hyper, meaning excessive, emesis, meaning vomiting, and gravidarum, meaning pregnant woman, is a condition which involves extreme morning sickness, including nausea, vomiting, and weight loss as its major symptoms. It is thought to be a result of high levels of pregnancy hormones, but the exact cause is not known at this time. Question number 4. Within how many days will the lochia alba last? A. 3 to 5. B. 5 to 7. C. 8 to 10. D. 10 to 15. The correct answer is D. 10 to 15 days. The third stage of postpartum bleeding is called alba and can last 10 to 28 days, but mostly 10 to 15 days, after giving birth. Lochia changes from pink to a light brown to yellowish white color. The mother may still experience occasional spotting of blood. Question number 5. Which of the following Leopold's maneuver is performed by the midwife when she first grasps the fundus to determine which pole of the fetus is present? A. First. B. Second. C. Third. D. Fourth. The correct answer is A. First. In obstetrics, Leopold's maneuvers are a common and systematic way to determine the position of a fetus inside the woman's uterus. They are named after the gynecologist Christian Gerhard Leopold. They are also used to estimate term fetal weight. The 4 steps in the maneuver are: first maneuver, fundal grip; second maneuver, lateral grip; third maneuver, second pelvic grip or pollex grip; fourth maneuver, Leopold's first pelvic grip. Question number 6. Which vitamin is important for the normal functioning of the nerve? A. Vitamin R1. B. Vitamin C. C. Vitamin B12. D. Vitamin A. The correct answer is C. Vitamin B12. B vitamins are known for their ability to support healthy nervous system function. Vitamins B1, B6, and B12 have been found to be especially beneficial for treating neuropathy. Vitamin B12 has an anti-apoptotic effect and possibly promotes nerve regeneration by inhibiting the apoptosis of damaged neurons and creating conditions for the recovery of nerve function. High-dose vitamin B12 promotes functional recovery of nerves, that is, sciatic nerve, after peripheral nerve injury. R1 is not a real vitamin, medically speaking. It is a combination of vitamins, proteins, and other high-potency nutrients sold primarily to athletes and people who engage in heavy to extreme physical training. Question number 7. Which of the following is not included in the specific objectives of prenatal care? A. To detect early manifestations of maternal high-risk factor. B. To promote curative measures in medicine. C. To prepare the mother for labor, delivery and puerperium. D. To promote and maintain the mother's good physical and mental health during pregnancy, labor, and puerperium. The correct answer is B. To promote curative measures in medicine is not among the specific objectives of prenatal care. Prenatal care generally refers to the routine, preventative medical care that women receive during pregnancy. The primary objective of prenatal care is to promote the overall health of mother and baby and to identify, prevent, and/or manage complications or problems as they arise. Prenatal and perinatal care includes 1. Determining what tests are necessary and when and how often they should be administered. 2. Administering and interpreting abdominal and vaginal ultrasound/sonography. 3. Early and ongoing assessment of a woman's risk status and risk reduction measures. 4. Health education, health promotion and psychosocial support, medical screening, and related interventions. 5. Accessing and addressing risk factors and/or any other health problems that may emerge. Promoting curative measures in medicine is generally the task of physicians whose main objective is to treat and cure diseases. Question number 8. Laceration which involves vaginal mucosa, the fourchette, and perineal skin is A. First degree. B. Second degree. C. Third degree. D. Fourth degree. The correct answer is A. First degree. A vaginal tear can happen during childbirth. Also called a perineal laceration, This is a tear in the skin and muscle around the vagina and perineum. The perineal area, also called the perineum, is the space between the vaginal opening and the anus. During a typical vaginal delivery, the skin of the vagina prepares for childbirth by thinning out. This part of the body is meant to stretch and allow the baby's head and body to pass through without trauma. However, there are several reasons why a vaginal tear might happen. These reasons can include a large baby, a very quick delivery, that is, the skin hasn't had time to stretch and thin, and use of forceps during delivery. There are several different grades of vaginal tears. These grades are determined by the severity of the tear. First-degree tear. The least severe of tears, this small injury involves the first layer of tissue around the vagina and perineal area. Second-degree tear. The second level of this injury is actually the most commonly seen tear during childbirth. The tear is slightly bigger here, extending deeper through the skin into the muscular tissue of the vagina and perineum. Third-degree tear. A third-degree tear extends from the vagina to the anus. This type of tear involves injury to the skin and muscular tissue of the perineal area, as well as damage to the anal sphincter muscles. These muscles control the bowel movements. Fourth-degree tear. This is the least common type of tear during childbirth. Extending from the vagina, through the perineal area and anal sphincter muscles and into the rectum, this injury is the most severe type of tear. Question number 9. The following are measures against infection during labor and delivery, except A. Care of bowels. B. Care of the breast. C. Vulvar and perineal hygiene. D. Advise mother to take a bath or shower. The correct answer is B. Care of the breast is not among the measures against infection during labor and delivery. Sometimes complications can occur during the labor or delivery process for various reasons, including infection. Infection occurs when germs travel to the uterus from various sources. Proper hygiene, particularly in the areas near or immediately surrounding the uterus, including the vagina, perineum, and anus, must be thoroughly cleaned before going into labor and delivery. Although it is ideal for the mother to ensure and maintain overall or full body hygiene, the proximity of the breasts to the uterus is far enough to cause infection during labor and delivery. Question number 10. A woman in labor is encouraged to void within and every A. 1 hour. B. 2 to 3 hours. C. 4 to 5 hours. D. No need to void as it will happen naturally during labor. The correct answer is B. 2 to 3 hours. Voiding means emptying the bladder. A woman in labor should be encouraged to urinate at least once every 2 to 3 hours. If her bladder is full, her contractions may get weaker and her labor longer. A full bladder can also cause pain, problems with pushing out the placenta, and bleeding after childbirth. You have just completed Midwifery Licensure Exam Reviewer number 9, which featured questions on primary or fundamental health care. If you wish to watch more Midwifery Licensure Exam Reviewers on primary or fundamental health care, check out our Midwifery Primary or Fundamental Health Care Reviewers playlist. Check out also our other midwifery playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it. We wish you all the best on your forthcoming midwifery licensure exam, and we look forward to your fulfilling career and professional life as a licensed midwife and healthcare provider in the Philippines. Mabuhay!